Good morning. My name is Nicole Knibb, and I'm the Education Coordinator at the McMaster Museum of Art at, of course, McMaster University. As a university gallery, we do use our collection and our exhibitions for interdisciplinary opportunities to challenge students to be critical and creative 21st century thinkers. The Art of Medicine is our ever-evolving arts-based course designed to meet the changing needs of medical education and practice in Canada. The goal is to build physician skills in observation, communication, collaboration, empathy, and mindfulness, and we hope will shape doctors' more compassionate whole-person care, including awareness of patients' diverse cultural and socioeconomic backgrounds, increased patient agency, and their own vocational stress. Oh, I shouldn't have run up the stairs. We're ensuring our role as a cultural institution continues to be relevant and necessary in meeting the demand for medical humanities, education, and contributing to effective doctor-patient relationships and doctors' ever-important self-care. So why do we do this? We're hoping to meet the needs, or to help meet the needs, of the CanMEDS competencies, which were introduced by the Royal College of Physicians and Surgeons of Canada in 2005, which lays out the skills physicians need for better patient outcomes. So here's what we do in the course. We do object-based visual literacy, art therapy and art making, descriptive writing, narrative and reflective writing, and movement and body awareness exercises. So interpreting a work of art takes into consideration visual cues, symbols, history, and cultural background. You become aware of perception, your own, the artist's, and your colleagues. We're doing a small a, small t art therapy approach. And this practical art-making approach complements time spent looking at art to improve observation and interpretation skills. The art therapy activities are also designed to help with doctors' self-care and stress management. These tools are for them to take actually into their everyday work experience as well. Residents are given journals at the beginning of the course and are encouraged to reflect on their time during the course and in clinic. Writing assignments are to be spontaneous and unedited. The residents are asked to describe a patient encounter in great detail and then to imagine a day in the life of the patient and writing from the patient's perspective. Dance and movement exercises acknowledge nonverbal communication and enhance, we hope, communication skills, mindfulness, and empathy. The program is being evaluated using both qualitative and quantitative methods to measure the effectiveness of the course. So I'd like to share some outcomes of the course so far. Patient questioning has become more effective. One resident was able to reframe questions to prevent her patient from circular answering and to get a more detailed answer. And faced with unfamiliar museum and art history terms, residents found it eye-opening and understood how their patients felt when unfamiliar and confusing language is being used. Art can be ambiguous, and it requires unpacking. The residents recognized the impact of ambiguity to their practice, but they actually became more confident in accepting that they did not immediately have the answers. We bring our own emotions and experiences to what we see as well. Group collaboration makes it clear that everyone sees something different in an artwork, and this collaboration allows for sharing of expertise and more effective problem solving. So I think all cultural institutions can and should participate in partnerships such as these to be engaged and to be responsive to changes, not only in medical education, but changing needs and curriculums in all levels of education. So teaching with objects, any objects, not just art, for you historical museum folks, allows for a fresh perspective for interdisciplinary learners. Inquiry-based learning is what we, as cultural institutions, do very, very well. Object-based learning develops intellectual skills necessary for 21st century competencies and to meet the needs of the CanMEDS competencies as well. Developing important and necessary community and educational partnerships, always good. And it nurtures positive attitudes to lifelong learning with members of our communities. It provides a social context for our educational programs, our exhibitions, and our wonderful collections. And thank you.